Chronic illness rarely looks like illness. Coming up, meet a young woman living her best life despite health problems that started at birth. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. Micky Foos celebrated a recent milestone birthday with a photo shoot. But these aren't just glamorous photo shots, they're proof that she really did make it to age 25, despite what some doctors had told her. Not to mention that one time when her heart stopped beating. What you can't see in these photos is the exhaustion, the shortness of breath, the pain, all part of her daily life as she lives with chronic health conditions. Today, we are learning more about what it's like to live young with chronic illness from Micky herself, who also happens to be Miss Sunflower State. And we're going to talk a little bit more about that and how you're raising awareness through that here in just a bit. But her mom, Dawn, is also joining us. This is as much your journey as a mother, I would imagine, right?
Oh, certainly. The whole family.
It's a family affair. We're going to talk all about it. And I'm so happy to also have with us Dr. Matt Littman. He is a cardiologist helping in Micky's care here at the University of Kansas Health System. How are you?
I'm well, thank you.
Good to see you. Dawn, Micky was first born with this heart condition. It's called tautology of Fallot. Did I say that right, Doc?
Yeah, tautology of Fallot.
Oh, okay. So it's actually 4 different heart issues. What did doctors first tell you when you heard about this?
Well, initially we didn't know that there were any problems, and her initial problem upon birth was a GI issue that they repaired surgically, but while in the NICU they found the heart problems. As they described the tautology of Fallot, there were the 4 pieces that qualify for it. She did not have all 4, but given the significance of what she did have at the time, which was 3 very large VSDs, the largest that cardiac surgeon had ever seen, and later she had some ventricular muscle bundles as well. And she didn't have all 4 requirements, but they went ahead and kind of put her in that tautology of Fallot, and you may be able to speak better as to why that might have been. Sure. But we had no warning.
No warning
at all.
So Dawn did a great job of explaining it, but maybe kind of more in layman's terms, explain to us exactly what this is.
Yeah, so tautology of Fallot is the most common cyanotic congenital heart disease. Cyanotic meaning babies who were born blue. About 1 out of every 10 patients I see in clinic have tautology of Fallot. Tautology of Fallot, the cardinal features are ventricular septal defect, so a hole in the bottom chambers of the heart, and then right ventricular hypertrophy, so the right ventricle hypertrophies, the muscles hypertrophy. There's an obstruction between the right ventricle and the pulmonary artery, okay? And then the aorta is overriding, meaning it's moved over more towards the right ventricle. So those are the 4 cardinal features of what we call tautology of Fallot. Most patients require repair before 1 year of life.
So Dawn, what were doctors telling you just about her condition in general? And I mean, she's just hours and days out of the womb. What were you looking at as far as long term? What were they saying?
Well, they primarily wanted to wait until she got a little bigger, and she was full-sized upon birth, 8 pounds, maybe 8'5", something like that. They wanted to wait until she was a little older and stronger, but in that time, her first surgery was at her first cardiac surgery was at 6 months, and that was for the VSD repair. And during that time, we were in and out of the hospital in congestive heart failure so many times, and that was before everybody had a cell phone. So I had the pediatric cardiologist, the pediatric surgeon, had both of their home phone numbers, beeper numbers, everything. We were first name basis, call them at home in the middle of the night, meet us in the ER, and they would inevitably admit her for congestive heart failure. And finally at 6 months, they decided, you know, it's time to try to fix this, and they did the VSD repair at that point in time. The rest came another year later, surprisingly. We weren't ready for it, but they did that. She was not really able to thrive because she didn't have the energy to suck down a whole bottle. So we had NG tube feedings and stuff like that just to try to make sure she had enough calories in. Had to wake her up every 2 hours, day and night, to feed her, you know, and in and out of the hospital a lot.
So while you're thriving now, as we see as Miss Sunflower State, Micky, tell us when you first realized, do you remember first realizing, wait, there's something going on in my life. This is something I'm now dealing with. I'm 5, 6, 7, 8 years old, and I'm in and out of hospitals. When did it really dawn on you?
So growing up, I had a pretty normal childhood. I climbed trees with my brothers and rode bikes and played volleyball for 9 years. And I remember when I would run in like gym class or volleyball, I would always be the last one to finish. And I would always be short of breath, but also I didn't know what it was like to not be short of breath. So I kind of noticed that I was a little bit different, but I didn't really have too many setbacks. So
Didn't feel like you had this, very excruciating heart issue that you were going to be dealing with here now at 25 years old. Dr. Lipman, how often do you see this?
Yeah, that's a good question. So about 10% of my clinic population will have repaired tetralogy of Fallot. Like I said, it's the most common cyanotic congenital heart defect, but we follow patients longitudinally to make sure they don't develop complications. And if they do, we act on them right away.
So is Micky pretty typical of what you would see? Anything that stands out different or makes her case unique?
The extra cardiac issues, the GI issues, does make it unique. But from a cardiac standpoint, I think everything's sort of going according to plan, natural history-wise.
So she's doing well.
Yes.
Doing well. And I take it she's a good patient.
Yes.
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 Okay. That's part of it. So, Micky, doctors predicted that you would have heart trouble in your early 20s. They were right. You did. You go off to college. But what was happening with your heart at that time and age?
So my freshman year of college, I went to Georgia Southern, and I started having chest pain, and I wasn't sure what it was coming from, so I just kept going to the ER. And I was in a very small southern town that didn't have a lot of medical resources, and so I had to drive an hour and a half north to Augusta Medical Center, where they diagnosed me with PVCs. And so I had an ablation my junior year, so 2018. I had an ablation, and they told me sometimes it takes more than one to really get all the PVCs, and I ended up having 6. So
What are PVCs for folks listening?
Premature ventricular complexes.
yeah.
Okay.
And so the bottom chambers of the heart beat before they should.
Got it.
Yeah.
Okay. So then you have a defibrillator put in, correct?
Yes, so in 2019, I went in for an ablation, and they said there was so many PVCs that it was causing damage, and they thought they might put in a defibrillator, but we didn't know until they got in there to do the ablation. So when I came out of surgery, they had put in the defibrillator.
And it ultimately saved your life in one instance. Can you tell
Yes.
us about that?
Yes. So senior year of college, I was dancing in my garage making a TikTok, and I had been cleared by all the doctors. It had been months since I had my last ablation, and I was feeling good. I was working out, which they actually encouraged me to work out and build up some strength again. And so I was dancing. I'd gone to church that day, was getting ready for work that night, and I felt my defibrillator go off, and I didn't know what it was because I'd never had it go off, but it felt like a car had hit me from behind, and it was very confusing. And then my roommates kind of found me and took me to the ER, and that's when they had told me I'd gone into cardiac arrest.
Wow. We always talk about the power of a second opinion here on our program. Dawn, I want to ask you how you came to find us here at the health system.
So we moved to Kansas 22-ish years ago. And at that time, she was a juvenile, so she was seen by Dr. Simon Ong at Children's Mercy. I think she's no longer there, but she was phenomenal. She's the one who actually told us you can expect some problems, a little bit later in life. We just don't know quite what those are going to be. And sent her off to college. She had one last check with her before she went off to school. So while she was away at school, she saw multiple hospitals. But she graduated 2 weeks, right? 2 weeks after you went into cardiac arrest, she graduated. She moved down to Florida to be near the Mayo Clinic for a year. And then it just kind of got overwhelming a little bit. And she decided to move back home. And in that meantime, she was diagnosed with her recent GI issues as well. And so someone had recommended a GI doctor here. And in the process, we found Dr. Lipman. And honestly, it was when we came to the emergency room, we weren't, when she had all her stuff done as a baby, we had no idea that it wasn't common, something that they were very well aware of. But we were told at one of our emergency room visits just in the last year that, you know, these congenital defects and the repairs that were done are a fairly new thing when she was a baby. So they weren't really sure how it was going to affect them as young adults, right? And Dr. Lippman was recommended to us as a congenital cardiologist, because in college she saw cardiologists who treat adults, but they're not aware of the congenital background, I guess, or the history and how that affects things as a young adult. And so it's very important that we see congenital specialists, which you may be able to speak better to in regards to how that's beneficial.
You having the specialties here at our place really can make the difference for patients. What was it like when you met these two ladies? What stood out about this case, and how did you go about making sure that she got on the right track and stayed healthy?
Yeah, good question. So I met Mary in October of last year, and she was in the hospital for chest discomfort, and I was able to see her and evaluate her, and I was able to talk to sort of the inpatient cardiologist taking care of her at the time about the unique anatomy, the repairs, and sort of what the complications are following the repairs. And then we met again in clinic in December of 2022, and really to establish a rapport, get to know each other, talk about the complications, talk about sort of what is to be expected over the next few years. And sort of, the fun thing about being an adult congenital cardiologist is detective work. You have to understand the history. That's everything. But the second most important thing, in my opinion, is developing rapport with patients. That's very important because most patients with congenital heart disease, they have their cardiologist. You have that person that you go to for all questions. So sort of, that's really the fun part about what I do.
Detective work.
Detective work, yes.
I like that.
Yes.
Micky, we first met you when you were in cardiac rehab, and I think we have some video of you doing that. Tell us what you do there and how that's been for you, and then Doc, tell us about how important it is that she's there.
Yeah.
So I started cardiac rehab, I think, last winter, and you do a lot of cardio, and you do some weights, just some very light weights, and then at the end they also do an education lesson on different topics like food, the importance of exercising, just any kind of heart health education. And I found it beneficial just because it was a way that I could move my body while also being monitored, so I knew that nothing was going to go wrong.
Just because you moved to rehab doesn't mean you're still a patient, right, Doc?
Right.
It's so important. Tell people, right?
No, it's very important, yeah. So cardiac rehabilitation is all about education. So it's really important to discuss diet, nutrition, exercise routines, but also just really having the education not only for yourself, but for your family members, and like talking through why nutrition is important. So,
Micky, unfortunately, Dr. Lippman is not the only doctor you see here, because you have other chronic illnesses. You've mentioned GI. Tell us what else you are also treating throughout this heart issue as well.
Yes, so I see Dr. Samo here. He's a GI specialist, and we actually just did a POEM procedure, which is a procedure on your esophagus, just a few months ago, and that went very well. And I also see Dr. Patel for neurology, for pain and trigger point injections for pain. And I see the pulmonologist here.
You're here a lot.
Yes.
We like having you, but
like
we'd
every
eventually like you to go away.
Yeah.
In a good way. Something fun that you had mentioned is TikTok. We know kids love to do the TikTok. You had an awful episode happen during that time. But TikTok has been a really good outlet for you to try to raise awareness and to share your story and try to find some good from it. Tell us a little bit about that.
So I post a lot on TikTok about my symptoms, what I'm going through, just humor. And I've met a lot of people all over the world that are dealing with the same thing. And it's crazy. I had one video go viral and get over 1 million views, and a lot of people are commenting like, oh, that happened to me too. Like, oh, I've experienced this. And So it's just really cool to like connect with people and also just let them know that they're not alone, that other people go through this too.
Let's take a look at one of your videos, shall we?
So PVCs in themselves are not something to worry about. I had many cardiologists tell me this when I first started having PVCs. They're like, okay, they're not really concerning. It's just something to keep an eye on.
How often do you post those?
Pretty regularly.
Doctor, what do you think about this kind of new way that people are reaching people, right?
No, yeah, I mean, I'm a fan. I mean, I think it's important to be an advocate. You know, I think that, you know, through social media you can sort of, you know, sort of spread your tentacles out to many different, you know, people throughout this country and, you know, throughout the world.
Yeah,
So,
the benefits
yeah,
of social
there are
media.
benefits,
It's
yeah,
good
there
to,
are.
there are benefits. They
right.
do exist.
They do.
Tell me, Micky, in spite of all this, you really are living life, as we see you sitting here with your sash. You walked the runway at KC Fashion Week. Tell us what that was like.
It was a dream. I loved it. I've been going to Kansas City Fashion Week since I was in junior high, and I never thought I would be walking on that stage. So it was awesome.
It was a moment.
Yes.
And now you're heading on to compete for the title of Miss Kansas.
Yes.
Tell us what went into making that decision.
So I started modeling back in October, and I really enjoyed it. And like I said, I am a huge advocate for heart disease, and I'm always looking for ways to spread the word. And I spoke to the director of cardiology here, and we just kind of brainstormed different ways to kind of educate the community. And I had gotten an email to register for, or to apply to be a contestant for Miss Kansas. And I looked into it because I'd never really done pageants, but I was like, what bigger platform than Miss Kansas to spread the word? So I started looking for sponsors, and I was like, you know, if I get sponsors, then it was meant to be. If I don't, it wasn't meant to be. And the community really gathered together and helped me out, and I got all my sponsors, and yeah.
So your journey, your health story, spreading the word about cardiac care and health and chronic illness is going to be your platform.
Yes.
That's so fantastic. Mom, what's it like just watching her truly live her best life?
You know, it's amazing. We still have hard days. You know, it gets frustrating, and but she's so resilient and has been since day one. I tell her all the time, you know, that hard-headed attitude that I maybe sometimes despise when it's turned towards me, I have no doubt is what has gotten her this far. So I love watching her succeed, and I love her passion for spreading the word and spreading awareness.
Yeah, that
I
mom-daughter
can't-
tension relationship can really push
Yeah.
things forward. I got a mom too. I know what it's like.
Yeah.
It makes you dig deep, right?
But it is that attitude that
Yeah.
has gotten her this far. I have no doubt. No
So,
doubt.
Micky, then what are good days and what are bad days?
So a good day is when I wake up, I'm feeling good. I have like minimal pain. I'm not very fatigued, and this might sound bad, but I try to do everything I can do in that day because I never know when I'm going to feel good again. So I'll see my family, I'll hang out with my nephew, I'll shop, clean, pretty much do anything that I want to do because you never know when you're going to start feeling bad again.
Do you get tired of explaining your situation to people, or do you use it as an opportunity to educate? And you can be honest.
I think I get tired of explaining it to medical professionals because I feel like it's just like a broken record.
Right.
When I'm in the ER and they're like, so tell me about your history. And I'm like, oh, okay. But to people in the community, I love it. I love the opportunity to share my story. I met someone in the ER the other day that was going through the same thing. They're like, you know, we've been searching for answers for so long and nobody can help us. And I got to be a, you know, example of
Advocating.
Yeah,
You were
advocating.
talking with them about advocating for themselves. And
Right.
Is there a question you get a lot? Is there anything that stands out that you seem like you're answering a lot, or maybe that's really interesting to people about your case?
I think I get asked what my tattoos mean, and then that's an opportunity to tell them about.
So you draw them in, you pull them in with the tattoos.
Yes.
What do the tattoos mean? Now you got to tell us.
Every single
So-
one of them has a deeper meaning.
Yeah.
Yes.
So
Every
I
single
have
one.
the heart here, and I have flowers growing out of it. just to represent that kind of the quote that's like, no rain, no flowers. Like, you can't have good days without having bad days, and just representing that something beautiful can come out of something bad. And then I have the survivor ribbon as well.
Fantastic. What's it like to have her sitting here with you, just doing all this and going
That's
on to
great.
compete and represent and advocate?
I think it's great. I mean, I think that it's really important for you to share your story and to be an advocate for your health, but also be an advocate and educator for other people who have this condition and other conditions. You know, I think that it's really important that we continue to kind of spread the word because a lot of patients who are born with congenital heart defects don't have good transition to adult congenital care. And so it's really important for you to educate people on that important topic.
And how do you help people find those resources? Because we've featured people who have childhood cancer and other childhood illnesses, and then it's like going through that pediatric period, and then you just kind of fall out of one system, and now you've got to go into the next one. It can be really complicated.
Right. It starts with pediatric hospitals and developing relationships with your local pediatric hospital. Here it'd be Children's Mercy Hospital, and here in Kansas City, kind of the referral process is through what we call a transition clinic, like telehealth.
Yeah.
And patients can then talk to Dr. Rockefeller or myself. In regards to their congenital heart defects, and then we sort of get them set up in our clinic that way. Yeah.
A lot of people often ask people who are sick, have chronic illnesses, is there's a mental aspect to it. Micky, how do you handle the mental aspect and stay mentally sound and healthy?
So it's interesting because, like I said, I went into cardiac arrest 2 weeks before graduation, and I graduated and I came home for Christmas, and then I immediately moved to Florida and started my job as a mental health caseworker for children and families. And I had this like overwhelming like kind of gloom and like kind of fear hanging over me. And I was like, maybe it's just the move, maybe it's just the new job, I don't know what's going on. And so I started going to a CBT therapist, and she was like, this sounds like PTSD from your cardiac arrest episode. And I was like, what? Like, PTSD, you hear it and you think, a veteran from war. But yeah, it's actually more complex than that. And it was just very interesting to discover that, because basically the way they explained it was, since my roommates were the ones that found me when I had that episode, I was then getting anxiety whenever I was alone at night. Because my body was telling me that, something bad is going to happen. So
you pay all this attention to your body, but mind is everything. Your advice, though, to people is to make sure they don't ignore it.
Yes, of course, yeah.
And Mom, same thing, same question to you. You're a mother. How did you mentally stay strong through all of this? And what advice might you have for others?
My husband is my rock. and I think he would say the same. We really leaned on each other. We were military at the time when she was a baby, so we did not have family around. We had a couple of close friends who helped us out with our other children while we would be at the hospital. But honestly, when she was a baby, we cried our tears, and it was down to business. We have business to take care of. This child needs to be taken care of. Let's full force research, find out everything we need to know, educate ourselves so that we know. And then, of course, you get to know your child better than anyone, better than any doctor, right? And even still in the 20s, I've made that comment to you before, just recently, actually. I know you better than anyone else on this planet, and your father does too, better than any of your doctors. Yes, I'm no doctor, but let's look into this, It's hard. It's hard. Aside from time, money, just watching your child go through something like that. And I thought as a baby that would be the hardest days of my life. But it's harder to watch her as a young adult go through it, because at this point she now understands, and she now understands the consequences of having a chronic illness. That being, sometimes you have to cancel your plans with your friends because you just don't feel well, and they get tired of hearing that, and that all the mental. My big talking point when we go somewhere and she's talking about it to someone, Afterwards, typically I'll meet some of the parents. They'll come up to me and ask me stuff as well. And my big talking points is basically watching their mental health as they do get older and begin to understand. You know, there's anxiety over, will this happen again? There's PTSD, there's guilt. Sometimes there's guilt. And it sneaks up on you. And the doctors don't talk about that. Doctors typically, and I mean, it's not a, you know, nothing personal, just it's not their focus. And they don't tell you to prepare for that. And it's hard.
And
it's hard.
Well, and you're also told to live in the moment. So here you are
Yes,
trying to just deal
certainly.
with one age at a time and one moment at a time. But it's really helpful for you to be open and honest like that and raw with what's coming down the
Sure.
road and to be prepared. Wouldn't you agree with that? To say some of the issues you're going to deal with when you're 5, 6, 7, 8 are going to be different when you're 25.
Right.
Mentally speaking.
No, for sure. And it's really hard to do that in a 30-minute clinic visit with somebody.
Oh, sure. Sure.
So
I was-
it's just hard to sort of unravel all of the complexities of the past. But it's important, you know, with adults with congenital heart disease, we really do try to focus on sort of the biopsychosocial model.
And help
care.
and direct them towards the resources.
Correct.
Right.
Right.
So before we wrap up though, Micky, I want to go back to those photos because the first day that we met, you had showed me this picture of you at this photo shoot you did. You had just celebrated your 25th birthday. You're holding the picture of you as a little baby. Very impactful. Tell us what was really again, it wasn't just about the vanity and the beauty. It was really deep for you to do that.
Yes. So I knew I wanted to do a shoot for my 25th birthday because I had a photographer friend that I met through modeling that offered to do a birthday shoot. And I was like, oh, that'll be fun. And then I was like, you know what? Like, let's incorporate these pictures. And so I put on my red, you know, for heart disease and held the photos. And
So you incorporated these photos to
Yes.
show here's where I was,
Yes.
here's where I am, right?
yes. And someone had told me like, oh, you're a quarter of a century now. And I was like, oh, wow, that's a huge milestone. So yeah, I wanted to incorporate the photos with it.
It's beautiful. And congratulations on
Thank
that big milestone. Big milestone for you too, Mom.
Oh, certainly.
What do you want the takeaway to this conversation to be for those listening and watching?
My big thing is advocating. When she was in college, she really had a lot. Honestly, one time she had a doctor come in, never even lay hands on her, never hook her to a machine, and said, "You look fine, go home." And she had a lot of that disbelief among the medical community in college, and that she could be having these problems, even though the history is there. It's literally in front of your face. And so she actually had to learn how to advocate for herself, and it was a big lesson that took a while to get there. Same with even your parents. Again, to the parents, you know your child better than anybody else, including all the doctors. If you really truly think your mother's instinct tells you something is wrong, you're likely right, and you need to push that they find the answer. When she was a baby, I did not want to leave. She was in NICU, or the CICU actually, and I didn't want to leave. We had friends wanting to take us out to dinner just to get us away from the hospital, and I just did not feel right leaving. But I let them talk us into it. We came back, they were doing CPR on her. They wouldn't let us back to see her because she had coded. And it was a turning point for me that I recognized that maternal instinct is really on spot. And at that point, I'm not listening to anybody else. You know, let's talk, right? Yes, let's talk. I'm not saying I'm not listening to the doctors, but I'm going to push for what I know is wrong, or advocate that they do take her seriously and look into what's going on, kind of thing.
Mother knows best. And I think doctors
Yes.
want that, even though
Yes.
you've got another person kind of in the kitchen with you.
Right.
You want that. You
Yes.
need someone
You do.
pushing and challenging you, right?
Yeah.
What do you want the takeaway to be today, Doc?
The takeaway from my standpoint, just kind of knowing that congenital heart disease is common. It's present in about 1% of the population. And so I think that it's just very important to understand that at baseline. But like Dawn said, mothers, fathers know best about their child. Mm-hmm. And as an adult congenital heart disease doctor, you learn that through your training. I think that's one of the most important aspects of seeing an adult congenital heart disease cardiologist, is knowing that important piece of information, because a lot of adult cardiologists don't train in congenital heart disease, and they don't know the family history, they don't understand the repairs and the complex congenital heart anatomy. And just sort of taking all those puzzle pieces and bringing them together, that's one of the challenges, the major challenges of what I do every day. But I love it.
So find the right place,
Right.
find the right specialty,
Right.
and find that connection with
Yes.
your doctor.
Yes, that's the key.
All right, Micky, tell us what you want the takeaway from your story to be.
Just advocating. Like I said, I like to spread awareness to let people know or educate people on heart disease, because everybody thinks it can't happen to them, and then it does. I have a lot of doctors tell me, oh, well, it might be this, but you're too young, so that can't happen. But then it turns out that that's exactly what it is. So yeah, just advocating for yourself and knowing the warning signs.
Yeah, well, thank you for living your life and being the face and showing other kids that they can grow up and be like Micky, be Miss Sunflower State. So tell us before I let you go, when is the Miss Kansas pageant, and then you'd go on to Miss USA?
Yes. So Miss Kansas is June 17th and 18th, and if I win there, then I go to Miss USA.
Nervous? Excited?
A little bit, but I'm excited, yeah.
So can we watch it?
Yes.
Okay,
And we'll live stream, and then there will also be a People's Choice, I think 2 weeks before the pageant, for the community to just vote.
All right, girl, you got my vote.
Yeah.
All right,
Thank
go
you.
get it. Love it. Love it. All right, thank you so much for being
Thank
with us.
you.
Dr. Lichtman,
Thank
thank
you.
you so much. And thanks to all of our viewers today. Have a great one. We'll see you back here tomorrow at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.